Oh,
Alrighty, so we have Joanne Peterson here. Her date of birth is 12/10/47. She has no allergies. She's a full code, and she is at high fall risk. So she came into us for admitting diagnosis of dehydration after she fell, and she was found by her son at home. She has a history of hypertension and asthma. Current medications that she's taking are furosemide 20 milligrams PO daily, an albuterol inhaler, 2 puffs as needed for shortness of breath, acetaminophen 500 milligrams as needed for pain, and then she lives at home. She has 2 children, and her son actually lives next door with a daughter 5 miles away. She is 145 pounds at 5 feet 4 inches. Vital signs around the board are all pretty normal. She's learn-oriented, in sinus rhythm with no chest pain noted. Breath sounds are clear, normal bowel sounds. She voided 100 mils an hour ago. Skin is normal, extremities are pink and warm. It looks like admission labs need to be drawn, but the lab team is on their way. She has a little bit of soreness from falling, but she's no broken bones. Today, looking at the orders, she is due for a Fluzone vaccine shot, and then she's due for a heparin shot as well, which would be given subcutaneously. So we are just going to go in and introduce ourselves and see if she needs anything before this procedure. So I'm going to provide for privacy. Knock. Hello, my name is Grant. I'll be your student nurse today. Can I just get your name and date of birth?
Joanne Peterson, 12/10/47.
Okay. So I'm going to do some hand hygiene. Put some gloves on. Okay, how are you doing today, Joanne?
Good.
Good. Do you have any allergies?
Nope.
Perfect. Are you in any pain right now?
Nope.
No? Okay. So you're comfortable?
Yep.
Okay. So what I'm here today to do is just give you a couple of medications. The first one is going to be just a regular flu vaccine, which is going to go right into your deltoid here, your muscle. Does that sound okay?
Yep.
And I'll give you some more education about that after I give it to you. And then I'm also going to give you heparin, which is a blood thinner, just to avoid some blood clots, and that's going to go into your belly, okay?
All right.
Okay. And again, I'll give you some more education about all those medications after we're done. Can I get you anything before I get out of here and get your medications?
Nope.
Okay. So now I'm going to leave the room, and I'm going to dispose of my gloves. Hand hygiene, I'm going to make sure that all the bed rails are up. She has her collet and the bed is lowered to a safe zone. I'm going to use hand hygiene and walk out of the room. So now at this time I'm going to begin performing, we're getting my first medication set up. So we're going to do our Fluzone first. We have our influenza vaccine. And now I'm going to perform my first med check. We have Joanne Peterson. She is set to get the influenza vaccine, 0.5 mils intramuscular injection. Looking at this med, it's clear. There's no discoloration. It is not expired. And there's no contradictions to her allergies, which she has none. And there's no contradictions to any other current medications that she's taking. And it's due now. This is the right time, the right route, right patient. So we have now completed our first med check. So now we can begin preparing our meds. So I'm gonna go do hand hygiene and just gonna grab some gloves to be safe. So I've done hand hygiene. I'm putting on gloves, and now I'm gonna draw up a half a mil of the Fluzone into my 1 mil syringe. I'm going to be using a 23 gauge syringe, which is going to be 1 inch long. This is an intramuscular injection, so it's going to go into her deltoid muscle. So we need a little bit of a longer needle to achieve that. And then I will be going in at a 90-degree angle when I do that. Okay, so I'm gonna go ahead and get my syringe ready, take it out of the packaging. Okay, get my blunt tip ready. Attach it to the syringe. Okay. Get my alcohol swab here. Okay, so now we're gonna draw up the med. So we're gonna scrub the hub for 15 seconds. 15 seconds has passed. We're gonna draw out some air, a half of mil of air. Inject it in. Draw the air into the syringe, and then we are gonna draw back about a half of mil of fluid.
Heparin 5,000 units per 1 milliliter, and it is subcutaneous.
All right.
Subcutaneous.
Zooming in to see this amount. It is, hopefully you can see that. It is a half of mil of fluid. I don't see any air bubbles, and it is primed all the way.
And this is for
So now we are gonna go ahead and cap our blunt needle, set it down. And now we're gonna go ahead and get this needle on there.
particles or anything weird. I also see that the expiration date is good. There's no expiration. Or there's it's not expired. And then I would do my second med check. I see that it's covering 5,000 units per 1
Now we're gonna put this on the needle.
5,000 units per 1 milliliter. I see that it is delivered subcutaneously.
Okay, so we have our medication prepared. We have the half a mil. And now that I have it prepared, I'm gonna do my second med check. Again, we have Joanne Peterson. This is Fluzone that we are giving her. I have it exactly a half a mil into a 1 mil syringe. Again, it's not expired. It looks normal. The coloration looks good. It looks ready to administer. It does not contradict with any of her allergies. This is the right time. This is the right route intramuscularly into her deltoid. So we are ready to go. So I am gonna get any more supplies that I need. So just looks like I just need a syringe or a alcohol swab, and I am gonna dispose of my gloves before I head into the room. Okay, there's a garbage can right here. Okay, and I'm gonna enter the room. So knock knock, privacy. I'm gonna walk over here. Hello, Joanne. My name's Grant. How are you doing today?
Good.
Can I just get your name and date of birth again?
Joanne Peterson, 12/10/47.
Okay, so I'm here with that Fluzone shot. I'm gonna go ahead and give that to you, okay?
All right.
So I'm gonna go ahead and, again, I'm doing my hand hygiene, and I am gonna grab some more gloves. So Joanne, this is an intramuscular injection. Today I'm gonna be giving it into your deltoid. Any other sites include just any strong muscles, like your gluteus, except this medication cannot go into your gluteus, but other intramuscular medications, you can go into your gluteus. You can also go into your thigh or any other strong muscle. So some contradictions you might encounter for this medication are just there might be some pain from the injection site, or some you might have a headache or just some dizziness. Okay. But
All right.
Nothing too severe, but just let me know if you start feeling some pain in that injection site. Okay.
Sounds good.
Okay. So I'm gonna dial before my third med check with my MAR. Here we go. So I'm now in my MAR at bedside. I have Fluzone. This is Joanne Peterson. Joanne, can I get your date of birth one more time?
12/10/47.
Do you have any allergies?
Nope.
No. Okay. I'm checking her wristband this time. It matched her date of birth matches. Perfect. And this is the right time. It's due now. And so we are ready to go. We've completed our third med check. So now I am going to take an alcohol swab. Or first, I'm going to find my site. So I'm using 3 fingers, and I'm finding my site right here using the 3 fingers. So now I've found my site. I am going to wipe off her site, wait for it to dry, and then I am now going to inject at a 90-degree angle. 1, 2, ready, Joanne? 1, 2, 3. Okay, I am taking the needle L at the same angle. Okay, I am capping my needle. And I am placing it in the sharps container. Throwing my syringe away and the rest of my supplies away. Okay, Joanne, so now that we've given you your flu shot, again, just let me know if you have any pain from the site or dizziness or headaches or anything like that, okay?
All right.
So now I'm gonna go ahead and get you your heparin and then we'll give you that shot, okay?
Okay.
Okay, so now I'm gonna leave the room, dispose of my gloves, again, making sure that her colite, handrails all in safe spots. So now I'm gonna go back in the room and I am gonna prepare my subcutaneous heparin administration. So again, I am just